Hello everybody, I want to welcome you to my presentation, Lidocaine Infusions, All You Wanted to Know. One of the main reasons I wanted to do this today was for the people that check in the patients and the MAs that bring the patients back and get their IVs in. You never get to see what goes on behind the scenes, so I wanted to describe what goes on behind the scenes. So here we go. So lidocaine, what is it? So it's a local anesthetic. It's used in dental procedures and for procedures involving the skin. That is 2% lidocaine. What we use for lidocaine infusions is 0.5% lidocaine. Not as strong, but it's going directly into the bloodstream. Now how it works, they're not 100% sure, but they think that it blocks the sodium channels in the cell membranes of neurons. And these cell membranes kind of play a role in beginning of building pain and inflammation pathways, and also the maintenance of those pain pathways and inflammation pathways. So it kind of reboots those pain pathways, gives the patient a temporary span of pain relief, and then the time that the pain takes to get ramped back up again, that's the period of time when the patient has pain relief. Now, reasons we give lidocaine. So trigeminal neuralgia, CRPS, neuropathic pain, fibromyalgia, migraine pain. And I think one of the coolest and one of the best reasons for giving lidocaine is to get people off opioids, because then they're less likely to have respiratory depression, gastrointestinal issues, and addiction and abuse. All right, we'll go back to our beginning slide here. Now, before we start, we make sure that the patient has not had any changes in health. Make sure they haven't had the cold or the flu or been hospitalized or had any procedures done. Make sure they don't have an infection or they're on antibiotics. If they are on antibiotics, then we reschedule their lidocaine infusion. If they've been off the antibiotics for 48 hours, then we can continue. They have to have a driver, and if the first 3 infusions did not help, which means that they did not get greater than 50% pain relief for longer than a week. So if they did not have 3 successful infusions previously, then we schedule them for a return patient visit, and they and their provider can come up with a different plan of attack. Now, normal side effects, what they're going to feel during the infusion. They might feel lightheaded, slight vision changes, sleepy. They might have some euphoria. They might feel buzzed or drunk, foggy or tipsy. Might have some tingling or some numbness of the lips and or tongue, ringing of the ears, nausea, dry mouth, or a metallic taste. Now these are all normal side effects, and as long as the patient wants to keep going, the nurse can do that. Now things we would stop for are some more serious side effects. Loss of swallow, unable to stay awake, inability to speak, tremors, tightness of the chest, changes in their EKG, profound increase or decrease in heart rate or blood pressure, and if the patient requests to stop. Now, if we do stop early, it's not a failure, and the dose is whatever amount we have given when we stopped. Different people tolerate different amounts to get the desired effect, and we can always re-challenge for a greater amount in the future. Now, with the next infusion, they will not feel the feelings that they feel with the first one as strong, because it's going to be going in slower, because whatever amount we stopped at is going to be the dose, and that amount will go in over a half hour, so it goes in a little bit slower. All right, now the time frame. So how long do these effects last? The acute side effects, the drunk, the dizzy, the tipsy, the numbness of the lips or tongue, those go away after about 10 to 15 minutes after the infusion is complete. Some people feel fatigue or a headache for the rest of the day. Lidocaine is metabolized and excreted from the body in 4 to 6 hours. So within that 4 to 6 hours, we don't want them driving or making any big decisions. All right, so as far as a review, lidocaine infusions are safe and effective under close supervision. There's a lot of precautions, and there's many responsibility for the caregivers. It does not work for all of our patients, but it does give great results for some patients. So I want to thank you all for being here, and I hope that you found this interesting, and have a great day.